Hi, I'm Dr. Brackup. This is the most difficult video I have to make because it's really hard to talk about yourself. I'm originally from New York. I was an undergraduate in Pennsylvania, and from there went out to California, where I graduated from Stanford University Medical School, and then did a residency in ophthalmology also at Stanford. I was there almost 10 years. From ophthalmology, I went on to a fellowship in oculofacial plastic surgery. And people will ask me, well, why did you leave ophthalmology? It's such a great field. And the truth is, it is, but there's no creativity in it. I found in plastics that it was an outlet not only intellectually, but artistically. There was a creativity necessary. Every case is different. And I loved it. So I pursued additional training. The University of Iowa, why did I go to Iowa? A kid from New York and then trained at Stanford because I felt it was the best in the country. I turned down fellowships at places like Harvard because I felt that Iowa was better. And it was a great year in terms of training. I wouldn't recommend it necessarily for the weather. It wasn't a lot of fun, but it was great in terms of my development. I was going to go back to Stanford and be full-time faculty, but my family's here. My wife is from Bucks County, and we came back here, and it turned out to be a great decision. It was very important for me to stay involved in academic medicine. One of the reasons I went to Stanford is because I wanted to be a medical scientist. So I'm on the faculty. I'm a clinical assistant professor at the University of Pennsylvania. I'm part of the fellowship program as an associate director for oculofacial plastic surgery. I train those fellows. I train fellows in facial plastics. They come up to the office. They come up to the surgery center to watch me do surgery. They won't do your surgery, but they allow me to stay part of that community. I still publish regularly in peer-reviewed journals. I'm invited to speak around the country and around the world. And I very much enjoy doing that still. It's a part of me that I feel I need to continue to be associated with. I'm not going to be a surgeon you meet who's going to be on one side of the desk and you're on the other, and I'm going to pontificate. We need to talk. We need to have a relationship. We need to have an understanding between us. I want to be approachable. It's just who I am. I also have to feel that I'm doing the very best for you that can be done. I'm limited. I don't do that many procedures. I don't do anything below the neck. This is all I do. I don't do noses. I do lots and lots of facelifts and eyes and brows and lasers. That's really what I concentrate on. And if I can't be the best doctor for you, I'm going to refer you to someone I think can do better. I want patients to love the experience of being here, love me, love my staff, and feel like they had the most outstanding outcome and experience they possibly can.